your laptop and your phone. I'm recording this little portion here using my iPhone 11, which I am using an adapter with that plugs the USB portion into the Lightning connection on my phone. Now this has been super handy for me when I've been recording my voiceovers for my YouTube channel and also my little TikToks that I've been doing too, just because it is super portable, it's handheld, I don't need to set up any big heavy equipment, it just plugs into my laptop, plugs into my phone, and away I go. And if you're looking to do like live streaming or anything like that, it comes with a tripod, a cradle, and a pop filter, so you can just set it up next to your camera or your phone when you're live streaming, or if you need your hands free. So I've included a link down in the description where you can find out more about this microphone, plus all the other microphones that Tonal make too. So thank you so much for listening, guys, and enjoy the rest of the video. Am I right in saying that you're here for just routine checkup? That's perfect. So here we go then. I'm going to just be looking inside your mouth. I'm going to look right at the back first, at these back teeth. A little bit uncomfortable there. Okay, I see a little bit of gum erosion there, but it's nothing too serious. Scrape. Plaque away. Now just bite down very gently. That's perfect. Well done. Hello there. Yes, it's wonderful to meet you too. My name is Dr. Hastings, and am I right in saying that you're here for just routine checkup? That's perfect. So before we begin, can I get you to confirm your name and date of birth, please? Yes, that's perfect. And are you experiencing any pain or any discomfort in your mouth at the moment? Alright, and any pain or discomfort anywhere else, as I'll be asking you to just lie back on the couch? No? Alright, that's perfect. So if I could ask you to just pop on those glasses there, that's perfect. And I will pop on some gloves. Whilst I'm doing this, I'm going to be asking you a couple of different questions about your oral health and your health and lifestyle in general. Alright? Yes, do get yourself comfortable. So, how often do you brush your teeth? Is it twice daily? That's very good. And do you use an electric or manual toothbrush? And do you floss every day? Okay. And what about other cleaning, oral cleaning products? Do you use mouthwash at all? Okay. And how long do you leave it from brushing your teeth to using the mouthwash? I see. I would recommend leaving it a little longer than that. Not too much longer. It's just that sometimes the mouthwash can be quite strong, and it just washes away all the properties of the toothpaste that you've just used. If you're using it for sensitivity, whitening, cavity protection, gum sensitivity, it just is a good idea to just leave it a little while after you've brushed your teeth to use the mouthwash. Do you drink tea or coffee? And how many times a day do you drink these beverages? I see. And what about use other beverages like wine or orange juice. Anything that would stain a nice white top. Okay, and what about smoking? Are you a smoker? I see. And do you eat any food in which is very, very spicy in terms of not only the spice content but also the colour of it? Anything, again, that would stain a white top? Do you suffer from anything like acid reflux or GERD? And what else? Smoking, drinking. You brush your teeth regularly, which is very good. Do you experience any sensitivity in your teeth, either from heat or cold? Okay. And have you ever experienced any pain in your teeth that you couldn't necessarily find the cause of? Have you had any problems with any specific teeth in particular? No? Alright, well, that's pretty much my questions. Now I'd like to have a little look inside your mouth. What I'm going to be doing is just looking at all of your teeth in turn, the bottom and the top. I'll also be just pressing on the gums just to see how sensitive they are, if they bleed or not, which could indicate any gum disease. Have you noticed any blood when you're brushing your teeth at all? Okay, that's good. Remember that if you see any blood when you brush your teeth, you should inform us right away, because this could be the start of gum disease. So, grab my instruments here. Now, if I could ask you to open up your mouth really nice and wide and say, ah, that would be lovely. It's a little bit uncomfortable, I know, and I'll try not to ask you too many questions whilst your mouth is open, because it's quite difficult to answer when you're in that position. And I know a lot of dentists do this when they have the instruments in a patient's mouth and they're like, oh, how are you today? Are you married? Do you have any kids? And you're like, So I won't do that. So I am going to start on the bottom and then move on to the top. Alright, I'll give you a little break in between so you can rest your jaw. So here we go then. I'm going to just be looking inside your mouth. I'm going to look right at the back first, at these back teeth. Very good. Okay. Yes, they all look very healthy. These are the back teeth. Doing very well. Okay. Alright, very good. Yes, have a little break. Your bottom teeth all look perfectly fine, perfectly healthy, perfectly normal. I do see a tiny, tiny little bit of plaque build-up in this middle bottom tooth, but honestly, nothing to worry about. As much as we can brush and floss to our heart's content, it is just the natural part of being human that we have plaque build-up.
so I can easily remove that for you today. I am a little bit concerned about a wisdom tooth, the bottom, your left, bottom left. Now, when was the last time you had x-rays done on your teeth? Right, okay, well that's fine. All I see is that the wisdom tooth is starting to emerge, and it's just putting a little bit of pressure on the teeth surrounding it. Now, gone are the days where dentists rip out all of your wisdom teeth as soon as they start emerging. We don't do that anymore. What we do is we have a look and keep an eye on any wisdom teeth that present themselves. And if it's causing pain, discomfort, or any problems in the mouth, then we do remove them. However, if it's not causing you any pain, discomfort, or problems, we just let it be. I remember when I was a kid, I had my wisdom tooth removed, and it was an awful, awful procedure, and I hated it. But I came to realise, becoming a dentist, I didn't need it out. My dentist was just very trigger happy and wanted to remove it. I don't know why. So we don't do it anymore. But what I will do is just put a note on your records just to say that the wisdom tooth is emerging. You might find, and we might find when you come back in 2 years for your routine appointment, that it hasn't even grown anymore. It's just stayed the way it is. Sometimes wisdom teeth can do that. So now let's look at your top teeth. And I imagine that they will be just as perfect as your bottom teeth. But let's have a little look. Yes, open your mouth. Say, ah, very nice. Okay. Alright. Let's start at the back here then. So now I'm going to just poke the gums here. Again, might be a little bit uncomfortable. Just poke it. A little bit uncomfortable there. Okay, I see a little bit of gum erosion there, but it's nothing too serious. Alright, so you have a little bit of sensitivity at the top there in this area here. I see there's a little bit of gum erosion there. Honestly, it's nothing to worry about. I think it's just down to age. Sometimes people can experience the gum erosion there through no fault of their own. It's just a genetic thing. I do see a tiny little bit of plaque on the inside of the top of the teeth. Probably having a little bit of trouble there. I also see a little bit of plaque right at the back of this tooth here, but we can remove that, no problem. It is really, really, really hard to keep the back teeth clean, especially if you're using like quite a large headed toothbrush that doesn't necessarily fit behind all of those teeth. So I do commend you for trying your best. So what I'm going to do now is just remove some of the plaque which has started to build up behind your teeth. Now this should be a relatively painless procedure. All you'll feel is a little bit of tugging on the teeth, and it might feel a little bit of a strange sensation once the plaque is removed, but honestly, it's not too bad. And again, if you feel any pain or discomfort, let me know. I will take a little break, okay? So yeah, open up your mouth, say ah. Very good. So I'm going to start on this bottom tooth here. Scrape. Plaque away. Are you doing okay? Yeah, it's a little bit uncomfortable, but you're doing really well. Okay. Good. There honestly isn't too much here, and I wouldn't worry too much about it. I'd just probably focus more on flossing here. Just spend a little bit more time in this area. Good. Okay. You alright? Do you want to take a little break? Alright. I'm going to do the top one now. Alright. Turn my instrument round. Good. It's a bit difficult, this one. Okay. Good. Good. I promised you I wouldn't talk. Alright. One more bit. Alright, that's really good. You're doing so well. Now I'm going to just do the tooth at the back there. There's a little bit of build up. So I'm just going to push your gum away. Let's just get in here. This one's a little bit more stubborn because there's a lot more build up here. Sorry, are you okay? Alright. Good. You're doing so well. Just a little bit more, a little bit, a little bit. Okay, I think that's got it. Are you okay? Oh, you're so brave, honestly. Now, if you would like to take a sip of water, well, it's not water, it's medicated mouthwash. If you just take a sip of the mouthwash, just rinse it around your mouth a few times and then spit it out into the sink there. There's also a tap for water as well, so if you finish the mouthwash, you can use some of the water as well. It's perfectly fine. So, your teeth look perfectly healthy, they look perfectly strong, your gums are really good, everything just looks fabulous. So whatever you're doing, keep doing. So do you have any more questions? Do you have any more concerns? Anything else you'd like to ask me? Yes, we do provide cosmetic teeth straightening and also cosmetic teeth whitening here at our practice. The teeth straightening, we can offer traditional braces, we can offer Invisalign, which is the clear braces. Depending on obviously the overall result that you are looking for, this can take anywhere between 6 to 12 months or even more, depending on how well your teeth react to the braces. But there's certainly something we can give you price options for and book you another appointment in if you were interested. Okay, and teeth whitening too. Well, that's something that we can actually do for you today. We can take impressions of your teeth and send away for the molds to come back. And the teeth whitening is actually a procedure that you do at home. So it's really, really convenient. No more dentist visits for teeth whitening. You can do it at your own pace in the comfort of your own home. Well, if you are looking to do teeth whitening and teeth straightening, I would suggest do the teeth straightening first and then whiten at the end, because your teeth are so sensitive when they're being maneuvered about. I would suggest doing it at the end. But if you wanted to brighten up your smile today, a lot of my patients here do the teeth whitening and then elect to not do the teeth straightening. It's a really weird psychological thing. When your teeth are brighter and whiter, the crookedness of the teeth almost is overlooked. Everybody says how wonderful your smile is, how bright and white your teeth are. They don't even look at how crooked your teeth are. And most of the time, the crookedness is only what we see in our heads. And some people always say, your teeth are really straight though, why do you want braces? So that's just down to personal preference and having a look at your teeth from a dental perspective. Your teeth are very nice and straight. Obviously you have a little bit of imperfections there, but what's perfect at the end of the day, right? But teeth whitening, again, it's a relatively low cost, very simple, painless procedure which can transform your smile without the laborious time it takes to straighten the teeth. So I would maybe suggest go for the teeth whitening and see how you feel after. Is that something you would like to go ahead with today? Well, that's amazing. So all I would need to do is take impressions of your top and your lower teeth. And this is really, really simple. All I need to do is mix up a mold, put it into a guard, place it on your teeth, wait a few seconds, and then that's it. Then your molds come to us, and then you can start your whitening, which I will talk to you about after I take the impressions. So, now that your teeth are all nice and clean, let's take some impressions. What I would need to do first is mix these two. This one's a catalyst, and this one is a base, is blue, and this one is white. And what we do is we take them and we smush them together, just like this, making sure that they're both equally mixed into one solid colour. It's all nice and blue. Just like that. And then we get the guard, and then we push all the material in like this. Like this. So it's all nice and full. Okay, so this will sit on your top teeth. I'd like you to bite down very, very gently. Not so much until you reach the bottom and you're biting the plastic, but just halfway down if you can. So I'm just going to pop this on your top teeth. That's good. Now bite down very gently. That's good. Yes, it does feel very full in the mouth, but if you just breathe gently through your nose, just keep calm. Honestly, it only takes a few minutes and then it'll be out, okay? Whilst that's working, we're going to take another base and another catalyst and mix up the mould for your bottom teeth. You're doing so well. So we need base. This stuff is very, very sticky. Okay, that's really good. Now we're going to mix these together. Good. Now the mold that cut, pop that in. All together nicely. Okay, so let's take this top one out for you first. Here we go. Perfect impression. And now let's put the bottom one in. Same principle. Now just bite down very gently. That's perfect. Well done. So again, we're going to leave that for a few minutes and that'll go hard, and then we can send both of them off to the lab. So whilst that's working, I'll just show you what you can expect from the whitening process and how it works. So when your molds come back, your guards, they will look something like this. And they are just clear, see-through guards which pop seamlessly on your teeth, because obviously we've taken the mold so they fit your teeth perfectly. So you get two, one for the top, one for the bottom, naturally. Then you will get 3 syringes of whitening solution. Now, the whitening solution comes in 2 types. One is a lower percentage of active ingredient, which you can wear for a longer period of time because it doesn't give you the sensitivity of the higher, stronger version of this. this one you wear overnight. So you will use half of a syringe a day. So 1/4 on the top guards and 1/4 on the bottom guards. And what you do is you just drop a tiny little amount on each of the tooth. You pop that onto clean teeth, so brush your teeth before. Pop that onto clean teeth. Press all the product so it is covering the whole surface of your teeth. Make sure that you wipe any excess off of your gums. Try not to get it on the gums because that's where the sensitivity can arise from. So then you wear the guards all night whilst you are sleeping. And then in the morning you take the guards out, you brush your teeth as normal, and then you rinse these mouth guards out with cold water. Try not to use hot water because it may distort the shape of the molds. So that's the overnight option. The other option is a little bit more quicker, but it has a higher percentage of active ingredient, which could cause greater sensitivity. This one, exactly the same principle. You brush your teeth, you apply the drops to the guards, you pop them in, and you wait 1 hour, no more. And then you take them out, brush your teeth, and away you go. The difference is just down to personal preference. They both work exactly the same. Some people don't like to have guards in overnight. Some people do. Some people like to just have it over and done with in an hour, and then that's it. So it's entirely down to you. So you will have a week's worth of syringes. And I will say that if this is your first whitening time, then I would suggest doing 1 day, miss a day, another day, miss a day, another day, miss a day, just to acclimatize your mouth to the product and the process. It can be a little bit daunting doing it in all one go, but that's why I suggest people to just break themselves in over time. If you find your teeth are sensitive, we do offer the desensitizing solution, which works again in exactly the same way as the whitening solution, but it helps to decrease the sensitivity that your teeth may be feeling. So you do drop, 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 and once you have removed your whitening solution, rinsed your molds out, your guards out, and brushed your teeth, you can apply this to your teeth, top and bottom, as a kind of desensitizing bath almost for your teeth. And this way it will help to alleviate any sensitivity that you might be feeling. Again, it all depends on your personal preference, but you'll get some of these as well. And I would recommend using those every time you whiten your teeth. Okay, does that make sense? Perfect. So let's now just take this bottom guard out. That's perfect. 2 perfect impressions. So those will take roughly 3 to 5 working days to be made. I'll give you a call when they're in, and I'll also give you your whitening solutions when you get your molds too. Do you have any questions? I see. So we can only achieve a maximum shade of whiteness. You see these celebrities in these magazines with these brilliantly blinding white teeth, and the reality is that they are not their own teeth. They are veneers, and they are little porcelain caps that go across your natural teeth to create that blinding whiteness. As human beings, our teeth can only be whitened to a certain level. And again, this will depend on your lifestyle, of your diet, and various different genetic factors as well. So we can only whiten to a certain level. Now, once you've come to the end of the course of whitening, we will assess how white your teeth have gotten, and we may recommend you to continue on for a couple more days just to see if this helps to bring up the whiteness. But please don't be too discouraged when you don't achieve that crisp white smile, because it is just not achievable. How long does it last? Well, again, it depends on your lifestyle, how much tea, coffee, red wine, etc. That you drink, and your lifestyle choices. But I have seen patients go 1 year, 2 year, even 4 years between their whitening sessions. Me, myself, personally, I found that after 2 years, I kind of could see that I needed a little bit of a top up. And then after 4 years from the initial concept, I would say that I needed to have a full course again. So my first course, I think I had 2 weeks of teeth whitening. My top up after 2 years, I only did 4 days. And then now I feel like I need to restart again and have that 2 weeks to really get my teeth white again. So I would say every 2 years have a small top up, and then every 4 years start again, if that makes sense. Perfect. Well, it has been really lovely to meet you, and I can't wait to start this whitening journey with you, and I look forward to seeing your results. Well, yes, until then, take care, and I'll see you soon.